So in this lecture today, what we are going to discuss is about how to read an ECG. If you look at an ECG, you might miss some important feature if you randomly look for some stuff. So it is important to read an ECG, in a sequential way. By that I mean, like this is an ECG. Let me take this. Okay. Here we have an ECG. So in an ECG, the first thing that we need to identify is what is a rhythm. What is a rhythm? What rhythm means, for if you take the R wave here, this is Q, this is R wave, and here is another R wave. The distance between this R wave should be equal now in all other leads as well. So suppose if this is, let's say, 3 large box is the distance between this R wave, it should be same in all other leads. This should be 3, this should be 3, this should be 3 box. Then we call this is the rhythm is regular. Basically it is a heartbeat. Okay, so if the rhythm is, after checking the rhythm, then our next task is to calculate the heart rate. So heart rate basically means, it is to find out the heart rate, you have to divide 300 divided by number of large boxes between this R wave. So here in case you can see it is almost 3 boxes, so the heart rate is 100. This formula applies to 300 divided by number of large boxes. Is applied only if the rhythm is regular. As you can see in this diagram, the rhythm is regular. The contraction of the ventricle happens in a regular interval. So what if the case is the rhythm is irregular? Where you can see the rhythm is irregular. Yes, in atrial fibrillation we get irregular rhythm. In that case, if someone asks you to calculate the heart rate, it is not possible for you to calculate 300 divided by number of large boxes. Why? Because the distance between the R wave, it is different. Okay, the distance between the RR wave is different. Okay, then that is called irregular. In that case, to calculate the heart rate, what we do is that we take an ECG up to 30 small boxes. Okay, so sorry, 30 large boxes, like 1 2 3 4 5 6 7 8 9 10, like that. 30 large boxes we take. Then we look the number of R waves in that number of R waves. So in this case here, let's say 1 2 3 4 5 6 7 8 9 10 11 12. Okay, so assume that this is irregular, the heart rate is irregular. Okay, here it is regular. So if that is the case, if the rhythm is regular, then the formula is 10 into the number of R waves in that 30 large box ECG strip. Do you understand? So assume that there are maybe 12 RR waves, then it is 10 into 12, that is 120 is the heart rate, 120 beats per minute. Okay, so that's about rhythm and heart rate. First know the rhythm, then based on that apply the equation to find out the heart rate. So heart rate is an important features. One can have a normal heart rate, maybe up to 150 170 depending on their age. Above that, when it happened, we will think of arrhythmia. So after knowing this rhythm and heart rate, our next important thing is to find out axis. See, axis is a different topic. In the exam they will in fact ask you to calculate the axis, so we will discuss this in more detail. Basically what axis is, like whenever, like in our heart, if we take the heart here, okay, let's assume that this is a heart. See, in a heart this electrical activity happens in different directions. From the SA node, it's some electricity is going down and reaching AV node. At the same time, some electricity, some depolarization is happening in this direction as well. Okay, and also after the current reaches the ventricle, depolarization, initially it activate, it depolarizes the lower part of the ventricle, that is apex, then it depolarizes other part as well. So electrical activity happening in different direction. So in physics we know the concept of vectors. So the net electrical activity, that is basically the axis is, let's say this is a normal axis, that is left lower part, this part, this I can you see the yellow shaded area, this is normal axis. So that is minus 30 to 90 degree, but for the purpose of the exam, like 0 to 90 would be, taking 0 to 90 would be easy for us. So yeah, so but let's say if the axis is left side but towards up, then this is called as left axis. Then if it is going towards right lower part, then that is right axis, and if it is going right upside, then that is extreme axis or indeterminate. So we have this four axis. Important to note here is that if it is extreme axis, one thing that should come to your mind is about ventricular tachycardia. Okay, all right. So in left axis enlargement, left axis is seen in left chamber enlargement. Similarly, right chamber enlargement is seen in right axis deviation. In right axis deviation, we can see right chamber enlargement. Yeah, that's it. Now our task is to find out the axis if they give us an ECG, but we will do that later. Just finishing how to read an ECG. Just we will go through the steps. So so far we have done like how to calculate the rate, then we rhythm, we have finished rhythm, then about axis. After that we will look the p wave morphology. I have discussed this earlier. P wave, where we see the absent p wave, okay, where you can see tall p wave, wide p wave. Then about PR interval. After p wave, after looking the p wave, we will check PR interval. Why PR interval is important? To check for the heart block, after that QRS. Why we are looking at QRS complex? To find out the conduction, if the conduction is happening through the muscle cells, the depolarization reaching the ventricle, whole ventricle, through the muscles in the ventricle itself, then that would be slow conduction contributing and making it wide QRS complex. If the conduction is happening normal through the His bundle, if the His bundle is activating the ventricle through Purkinje system, then that is narrow QRS. It is important for us to know the type of arrhythmia we are dealing with. We, based on QRS complex, we decide whether it is ventricular tachycardia or whether it is um, PSVT. Well, arrhythmia, again, different chapter, we will deal about that. And more, and apart from looking at the QRS width, another important thing that we should look in an ECG is whether the QRS is missing or not. Missing of QRS complex after P wave is also a kind of heart block. We have different type of heart block. One of them I already mentioned, that is prolonged PR interval, and another is missing QRS complex. Heart block, again, separate lecture. Then after QRS, what we have? We have ST segment. I don't have to mention the importance of ST segment. All of you are aware. ST segment elevation can be MI as well as other causes like pericarditis, depending on the shape of the ST segment. Can be convex, can be concave. We have discussed that already. So after ST segment, look at the T wave for hyperkalemia, hypokalemia, early changes in MI. That's it. After looking T wave, after looking at this T wave, next priority is to find out this one, very important, QT. QT interval, starting of Q to starting of ending of T wave, that is called QT. QT interval is important because prolonged QT interval can cause a type of arrhythmia called polymorphous ventricular tachycardia, and some drugs can cause prolonged QT. So those drugs are if people taking those drugs are at increased risk of having those sort of polymorphous ventricular tachycardia. So yeah, that's how we read ECG. Let's look at an ECG and see. Okay, so just ignore this part as of now. We'll discuss axis. So um, if we look at this ECG, you can see first what we will do, we will check whether it is whether the rhythm is normal or whether it is irregular. Okay, rhythm is regular or irregular. So if you take this, this is R wave, this is another R wave. See, number of R wave is almost 3, and take another R wave here, over here, this is R wave, this is R wave, number of large boxes, again 3 boxes. If you take another R wave here, another R wave here, again number of large box is 3. So what does it mean? It means the rhythm is what? Rhythm is regular. Now after rhythm, our priority is to calculate the heart rate. In regular, if the rhythm is regular, as you know, the formula to calculate heart rate is 300 divided by number of large boxes. In our case, the number of large boxes is how much? It is 3. Number of large boxes 3. So 300 divided by 3, that is 100. So the 100 beats per minute is the heart rate of the ECG which you are seeing now. So, and after seeing the heart rate, next our next priority is finding out the axis. So determine the axis, whether it is normal axis or whether it is left axis, right axis or extreme axis. Determine that. Then look for what? P wave. Let's look at a P wave here. Okay, so we have a P wave here, we have a P wave here. Yes, P wave is present, so we can exclude atrial fibrillation here, and more than that, you can exclude atrial fibrillation in the beginning itself. Because what? Because of what? Because of the rhythm. Regular rhythm is not seen in atrial fibrillation. Atrial fibrillation always will have irregular rhythm. So if there is an option in the MCQ, atrial fibrillation, don't in the beginning itself look for P wave. You can get confused uh, in looking for P wave. Some waves, you may think that it is P wave and you may exclude that option, but in fact it may be atrial fibrillation. So my suggestion here is to look first for the rhythm, then look for the P wave. If the rhythm itself is irregular, rhythm is regular, then it's not going to be uh, atrial fibrillation if the rhythm is regular. All right, so yeah, then you don't need to worry about the P wave and or just look at the rhythm. Regular rhythm means it's not atrial fibrillation. Okay, so we have looked at P wave. What is our next priority? Yeah, look at the Q wave. Where is the Q wave? Whether it is more than one large box, sorry, more than one small box, then it is abnormal. MI change. Then after that Q wave, what we need to look at is about yeah, PR interval. PR interval. Let's see a PR interval in this case. So here is the P wave, you can see here. Okay, you can see here, this is a P wave, and the starting of the P wave to starting of the Q wave. So this is the what? PR interval. So if we look at the PR interval here, it is less than almost equal to one large box. So PR interval is normal. So we have excluded a type of heart block. At least it's not first degree heart block. Now PR interval is normal. See whether you get. Next one is about what? P is over, Q we have finished. Now looking at the QRS complex. First thing is QRS complex is present or not. Every P wave in this ECG is followed by a QRS complex. Every P wave is followed by a QRS complex. Every P wave is followed by a QRS complex. Okay, so there is no missing of QRS complex. So we again excluded a different type of heart block. Again, heart block will be discussed in different lecture. Okay, so QRS is present. Now check whether the QRS is wide or narrow. QRS is wide or narrow. It is, all of you know, it is at least less than 3 small box. Less than 3 small box means it's narrow QRS, or it's mean normal QRS at least. Narrow QRS is normal QRS. Okay. Okay. Now what is next? So we have done about PQ QRS complex. Look at the ST segment. Here the ST segment is normal. Then look at the, can you see here, this ST segment is almost normal here. ST segment here. Okay, so that is about the ST segment here. So ST segment is normal. After that, look for the, what is this wave? T wave. T wave should be, if I take this chest lead, it should be less than 10 millimeter, which means less than 2 large box. So let's take V1 to V6. See, let's look at V1. It's very small. It's not even one box, so T wave is normal. Let's take a limb lead, and in limb lead means 1, 2, 3. In limb leads, it should be less than one large box, less than 5 millimeter. Let's see here. Yeah, it is okay. It is definitely, it is less than one large box. So yeah, we have now our priority is to look for the QT interval. We have discussed P wave, Q wave, QRS complex, ST segment, T wave. Now look for QT interval. See whether it's prolonged or not. So let me tell you that the normal QT interval is almost 11 box. 11 small box means 440 millisecond next axis. So yeah, 11 box, maybe like different differ in gender. Like some cases it can be up to 450 as well. All right, so let's see whether it is, whether the QT interval is more than 11 small box or not. Let's see here. Let's take our classical lead, that is lead 2. So let's say this here, this is a lead 2 we are taking. Okay, so let's say here is the Q wave, and let's take the end of T wave. This is the T wave, end of T wave is here. So this distance, can you see here? Yeah, this distance is the QT interval, the distance between the Q wave and distance between the start of Q wave and end of T wave. Start of Q, end of T. So this is definitely going to be almost up to 2 small box. Yes, 2 small box. 2 small box means 400 millisecond, so it's still normal. Okay, now let's look another. Let's say here, this is the Q wave, this is a T wave. Again, it's going to be less than 2 large box, so the QT interval is normal. So this is how we will look at the ECG, how we read. So in the next lecture we will deal about axis determination, very important. Thank you.